Okay, that is about polycystic ovarian disease. That was a question, and just because you're diagnosed, you're having an ultrasound scan report showing polycystic ovaries, it doesn't mean that you are affected with polycystic ovarian disease. Lots of other features also need to be there. Symptoms also need to be there to classify a girl as having polycystic ovarian disease. Okay, the most common thing would be irregular periods or no periods at all. Okay, that is the one point. And the other one would be definitely the ultrasound feature showing cystics. Cyst means a water-filled thing is called a cyst. And the in polycystic disease, these cysts will be numerous in number than the normal ovaries. In normal ovaries, the follicular number will be less than that of the polycystic ovaries. And these cysts will be gathered or scattered around the periphery of the ovaries. That is the scan finding that we see in polycystic ovarian disease. And the other thing is the hyperandrogenism, features of hyperandrogenism, excessive facial hair, excessive body hair, acne, oily skin, and things like that. Or a biochemical evidence, that is a blood report that is showing high level of testosterone. Testosterone is definitely a male hormone, but it is also produced by the ovaries, and if it is produced in excess from the ovaries, that also is a feature of polycystic ovarian disease. Other than that, these girls, mostly they are obese girls, and they will have some kind of a blackish discoloration over their neck area, back part of the neck, and as well as their armpit. And that is called as acanthosis, and that is also considered as a feature of polycystic ovaries. And these girls will be they'll be depressed, and they will have low self-esteem because of these body features they are having. And there will be a lot of hair fall, and because of the androgen.
High androgen level.
High androgen, hair loss, and as well as acne and I told you facial hair and things like that.
So, what is the line of management, doctor?
The first and the most important line of management would be a lifestyle modification. What I mean by lifestyle modification is a healthy, balanced diet along with exercise, which most of the young girls don't have because they are very busy with their studies. They want to prepare for the entrance and things like that, competitive exams, and they don't have time for their daily routines. So how can they go on having exercise kind of a routine every day? But that is very important in case of a polycystic ovarian disease. You need to take a healthy, balanced diet. What I mean by healthy, balanced diet is that you need to include plenty of fruits and vegetables in your diet, and you need to take whole wheat or whole rice, that is brown rice is very good, and cut down your carbohydrate and increase the protein and
another doubt is that doctor, can they conceive later?
Yes.
Will it be a problem?
Yeah, because in polycystic ovaries, as you know, there is a difficulty in getting pregnant because there is difficulty in ovulating. So once ovulation occurs, only there is a chance of getting pregnant. So since these girls, they are having difficulty in ovulating, they definitely will have a difficulty in getting pregnant. So in future, definitely this can carry on. If they don't do enough exercise and if they don't eat properly, they can definitely go on to have infertility in future. The most important long-term complication is diabetes mellitus, and diabetes, as you know, is a condition where there is a difficulty for the body to control the sugar levels. So these girls, they will have a family history, their parents or their uncles or relatives, anybody will be having diabetes, and they are more prone to developing diabetes during their pregnancy as well as in the later life. And another complication is cardiovascular problems because they tend to have high BP in later life, and the diabetes along with the high BP can predispose them to cardiac problems in later life. That is the long-term complications mostly.
Polycystic ovarian disease.
And another thing is that there is an increased susceptibility to cancer, that is endometrial cancer. If you're having infrequent periods, that is less than 3 to 4 periods in 1 year, your endometrium, that is the lining of the womb, inside the womb, which is shed regularly during the cyclical periods, it tends to get thickened, abnormally thickened, and it tends to become cancerous and it can lead to endometrial cancer.
So these type of patients, do they have to be on a regular medicine or something like that?
Most important treatment for these young girls is not medicine but lifestyle modification, diet and exercise. But if they are very much worried about their infrequent periods, they're not getting periods once in every 3 months, yes, they need to take some medicine so that their endometrium, that is the lining of the womb, is protected from endometrial cancer. So we usually give progesterones we combine it with estrogen and give it as OZPs, oral contraceptive pills, usually given for cyclical control.
Okay.
There is an added advantage of giving oral contraceptives because the oral contraceptives will reduce the dysmenorrhea. If they are having painful periods, it will reduce the dysmenorrhea.
Okay.
It will reduce the amount of bleeding. It will give good cyclical control. That is, they will have withdrawal bleeding every month regularly.
Okay.
So that is usually that is the line of management.
Okay.